Good afternoon. My name is Corina Herrera Loera, Public Information Officer for Santa Clara County Emergency Operations Center. We're here again in our community forum. A very exciting day. I know some of you were waiting to hear if you won tickets today, and I know the announcement went on not too long ago. So I am unfortunately don't have the names yet, but hoping to have those by the end of this live so I can also let you know who won those today. We have two special guests, and I will be introducing them shortly. And before I do, I'm going to give you an update as to where our county currently is. So next page, please. As you all know, we have entered a new phase in our county, but I do want to give you an update in regards to our current cases. As of yesterday, we had 31 new cases of COVID-19. And 0 deaths. I will highlight some of these numbers a little later in the presentation. Next slide, please. So as many of you are aware, and if not, just continuing to highlight again the numbers broken down by ethnicities in our counties, and specifically want to highlight the numbers within our Latinx communities. So in our Latinx community in our county, we make up 25.8% of the population. However, we continue to make 50.3% of those with COVID-19 cases. Next slide, please. And so, as I mentioned earlier, our county has entered a new phase. The local health orders are being phased out effective June 21st at 12:01 p.m. And so some of the changes are in light of declining cases and widespread community vaccination against COVID-19 and the newly adopted workplace regulations issued by Cal OSHA, the County of Santa Clara is phasing out the May 18th, 2021 local health order. Next slide, please. The order is still in effect for businesses or governmental entities who have not yet completed 2 rounds of ascertainment of vaccination status of their personnel. Once the second round is complete, the May 18th order does not apply to them anymore. All entities to follow Cal OSHA regulations. And we get to continue working together to keep risk of COVID-19 low and protect those who cannot get vaccinated. So what we are encouraging all those in our county are to get vaccinated, continue to hold activities outdoors, avoid travel if you're not fully vaccinated, continue to regularly test for COVID-19 if you're not fully vaccinated, and regardless of vaccination status, get immediately tested if you have any symptoms. Next page, please. And so I do want to highlight our current numbers as of June 21st. You can see here, we are 59%, the Hispanic Latino community are 59% of those vaccinated in our county. Now, I do want to highlight, right, that we have 80% of those 12 and older in our entire county are vaccinated. However, when we break it down to our Hispanic Latino community, we're still not celebrating because we are only at 59% of those 12 and older. So still lots of work to do. And, ensuring that not just As you can see here, there's certain communities who are almost 100%. And, I will be celebrating once, we are at approximately, 75% vaccinated. Because as I mentioned earlier, we're still testing positive for COVID-19. And so we want to make sure that we keep those numbers down and get to zero eventually and get our vaccination up to, the 100%. It would be the ideal place. Next slide, please. And so just a reminder, all individuals ages 12 and older are currently eligible for the vaccine. And so visit scfreevax.org or call 211 to schedule an appointment. And we have several locations. Next slide, please. And we have different opportunities. Currently, we have this raffle that we have for anyone who gets vaccinated to receive free tickets to certain concerts. So today, this one ended today. So as you can see here, new winners will be announced every Wednesday at 2 p.m. on the Instagram Live. And those were announced today. Again, I'm looking to get those names. A social media post will go out, is what I'm understanding, shortly. So those numbers and those names are being pulled out. But if you do get vaccinated, you put your name in one of these artists' box with their name. And if you win, your name will be called on that Wednesday the following. And so every week we have new artists. So this past week, it was this one. We had Bad Bunny, Harry Styles, Enrique Iglesias, Ricky Martin. And next week, I believe, yes, next Wednesday, we'll have a new set. And I don't know if Quetzal will be able to put up the flyer right now. And if she's not able to, we'll have the announcement and the flyer out on our Facebook page. So just look out for it. And that will be the new one for next week. We have new artists. So look out for those. Next slide, please. Okay. And then these are locations that we have this week, June 21st through June 27th. And so some of those areas within our East Side community are the Eastridge Mall. You can see there Monday through Friday, 11 to 6. And then Saturday and Sunday, 9 to 4. We have San Jose State University, which is also pretty known and pretty centrally located, Wednesday, June 23rd, today. So after this live, you can head over there up until 7, and many others. So if you do go back to watch this, you can put it on pause and get the location that best serves you, or go to our website and you can also get the information through there. Next slide. These are other locations that we have. Overfelt High School is also a very well-known location, and that's Thursday and Saturday from 10 to 5:30, Friday from 11:30 to 7:30, and Sunday from 9:30 to 4:30. And I was just there on Friday. My daughter got her vaccine, which you get to hear about in a little bit. And that great location, very warm staff who were very caring and loving to my 12-year-old daughter, who was a little nervous, but did great overall. Next slide, please. And so just some helpful resources, reminders, phone numbers. If you haven't gotten them down, write them down. The COVID support line, 808-7770. I'm going to highlight the mental health services. This year and a half was very hard for many of us, if not all of us, in one way, shape, or form. So the 1-800-704-0900. And then I'm going to highlight also the crisis hotline number, which is 24/7. And that number is 855-278-4204. Or you can text RENEW to 741-741. Next slide, please. Again, just numbers, call center 211. And then those of you who prefer texting, you could text COVID-19 to 211, 211, I believe. Yes. Okay, next slide, please. Thank you so much. Thank you, Quetzal, for helping us out with the presenting. And now I want to introduce Maria. Maria Miller. She's a youth in our community, very active, very involved. I've seen her do ballet folklorico. I've seen her do classes through Teatro Visión, and so many other amazing things in the community. She's a student at Lincoln, but I'll let her tell us a little bit about herself, and then we'll be asking her some questions. Welcome, Maria.
Thank you. Well, you kind of covered it. I'm Maria. I'm 16. I got my Pfizer vaccine when I was 15. I got both of the doses, and I highly encourage everyone else to. I'm a Lincoln High School student, and I do cheer and dance there. Yeah.
Nice. Thank you, Maria. So you got both you got both already in. Can you tell us why you decided to get it?
Yeah. So I lost someone very close to me to COVID. So it's just my whole family, it's super personal to us, you know. We lost someone who we loved a lot, and we have a way to prevent that from happening now. We didn't before. She passed away in March of 2020, which was when everything was kind of like just starting. And since then, we've taken the precautions. We've, you know, stayed in lockdown when we had to, which I'm sure everyone else has. You know, everyone in the community played a big role in keeping everyone safe. And the next step of doing that is getting the vaccine, which is why it's important for everyone to take a part of their role in the community and get their COVID vaccine.
Thank you. Can you tell us your aunt's name?
Her name was Carmen. Carmen.
Mm-hmm. Thank you. And I just want to, acknowledge her in the spirit world, and also, that that what you're doing now, the even talking to the community here is also helping her spirit in one way, shape, or form. So just remembering and honoring her name. Thank you for being here. And also, I mentioned a little bit about my 12-year-old. Who I was, having a conversation with, and we were talking about getting the vaccine, and she was really nervous, and I didn't want to be that mom of like, you force them, and like, so I wanted to kind of give her space. But can you tell us what happened on Friday, this past Friday?
Citlali, who is Karina's daughter, she's also my friend. She's 12, so she's eligible to get the shot, and she was super scared. And I don't blame her. I was really scared too. I hate shots. I hate needles. It scares me so bad. But we talked a little bit, and of course he talked to her too. And we got there. The nurses were super sweet. They did everything in their power to reassure her it would be okay. And she was scared. She was crying, but not because it hurt. She was just scared of anticipation. All the anticipation was building up. And once she got it, she was like, it wasn't that bad. It's like, yeah, it's not that bad. It's just scary before getting it. It's scary because you don't know what's going to happen.
Mm-hmm. Yeah. How did you feel before you got it?
I was scared. I hate shots so much, but I was looking forward to getting it because it's just like we've been trapped for a year, just having constant fear of getting COVID. I know the realness of it, what can happen. Sorry if you can hear my little brother, but it's just some people don't understand the reality and how scary it can be and the consequences of having COVID. And you can prevent it by getting the shot. So I was scared, but when I got there, I was like, I'm doing this for a reason. And I was hopeful. It gave me a lot of hope.
Thank you. Did it hurt once you got it?
No, mine did not hurt at all. I didn't have any side effects.
Wow. And so, audience that are out there watching and listening in, I encourage you to, hear the beautiful testimony of Maria in reality, right? And I got to bear witness to her encouraging my daughter, to where it was easy. I mean, my daughter was like, "Let's go, and we can get ice cream after." And so we did that on Wednesday. And then after, they were dancing and moving around. So if you have any questions, appropriate questions as to the discussion we're having here with Maria, please jot them down. She'll be on for a little bit to answer any questions. So if you have any questions related to what she just talked about, please ask them. And Maria, I wanted to, you're 16 and you have a beautiful relationship, you motivate my daughter and you're like a role model, you are a role model to her. But what encouraged you on Friday to send a text and say, "Hey, Citlali, does she want to go get the shot?"
One thing that my mom showed me was the concert ticket. That really got me excited. And I encourage everyone else to, because if you already have the shot, you can bring someone to get their first shot, which is what I did with Citlali. And we both got to put in our name for the raffle.
Nice. And which artist did you put your name in for?
Harry Styles.
Harry Styles. So you heard, and there's opportunity. They just picked the names today, Maria. So who knows? Maybe you were a winner. So I'm gonna, and I don't know if you kept the tickets, but I'm gonna share out the number of the tickets. I won't say names because we're live, and so we'll do that, and connect with people individually. But if you do have your number, and you might be able to bring that out. The numbers that won are 088373, 088273. I'm sorry, 088237, 750488, 087089, 088117, 751192, 087692, 879557, 088445, 879215. So those were the ones for last week. So I'm going to read the first three again because I know that I messed up on the second one. So I just want to make clear. The first three are 088373, 088237, and 750488. And then you can go back and rewatch this if you find your ticket. And go to Instagram where they did it live, I believe. So if you have any questions for Maria, please ask them. Otherwise, thank you so much, Maria, for being on. Thank you so much for sharing your experience with us. Very valid. Our condolences, my condolences to your family, for your aunt. And I'm sure she's proud of you, here sharing your story, sharing her name and sharing, the reality in your family and how your family was affected by COVID and how you decided to personally take it on to get the vaccine, for yourself and your family and your community. And so with that, I know you might stay, towards the end, you may not, but thank you for providing time to answer any questions that were directly to you. I'm looking at the list here and I don't see any questions from Maria particularly. So I see Aurora mentioned, thanks for the information on opportunities for the youth. So yes, absolutely. I also want to say that Maria was like, is there any opportunities for me to volunteer this summer with me and my friends? I'm bilingual. And so thank you, Maria, for that. We need more youth like you and you motivate others to get involved. And so we appreciate you very much. And we look forward to seeing you again, maybe at one of the next lives. Have fun. I know you have to go to your cheerleading practice and so many other things you get to do in the community. So thank you for being on and we'll see you soon again.
Yes. Thank you for having me.
Thank you. Bye, Maria.
Bye.
All right. And now we're going to bring Dr. Gerardo Solorio Cortez, whom most of you know, but if you're joining us for the first time, Dr. Solorio Cortez is one of our leading doctors in Gilroy, California, and he's out there doing work here for COVID-19. I'll let him tell you a little bit more of his role there. He has some updates for us and is here to answer any questions related to COVID-19 and what we are talking here about. So if you have any questions, please take advantage of Dr. Gerardo Solorio Cortez's time and expertise. And so if you want to ask the doctor any questions regarding the vaccine, maybe within our community or just in general, he's here to answer questions about that. And so we'll, after he gives us an update, then we'll go to Q&A. Thank you, Dr. Solorio Cortez. Welcome.
Hi, good afternoon, everyone. Thank you once again, Karina, for inviting me today. I'm super excited to be here, like always. Again, I am a doctor at Valley Health Center in Gilroy, primary care doctor, and I'm also one of the doctors that vaccinates at the Gilroy High School Clinic. And today, basically, the biggest announcement that we want to make as a county, as a nation, is that you need to get vaccinated. We have so many supply of vaccines, so many spots where you could go and get your vaccine. So pretty much, we're asking the percentages of people that are left to please get vaccinated. As Karina mentioned at the beginning, we're very happy as a county being at the 70-80% vaccination rate, or getting one vaccine for our community. But there are pockets in our communities that haven't reached that percentage. And as Karina mentioned, there is that 59% in the Latinx community. So I would really reach out to our Latinx community, our ages of 18 to 40, which is the block of people that are not at that 70-80% rate. So I really encourage you all to please get vaccinated. And I really enjoyed Maria's testimonial. I actually said in one of our Facebook presentations probably a month ago that it's our stories and disseminating the information through Facebook, but also at our homes, at our social gatherings, places of worship, where we're gonna tell our stories of how COVID, the disease, affected many of us, and did so much damage in so many ways. And it's so, again, going back to Maria's story, it's so heartbreaking. And I think now her story too of getting vaccinated is so important, and it's putting that history, or putting that story to why we're doing this is very, very, very important, and I think it's very influential. So I really, again, encourage everyone to please get vaccinated. And yeah, one of our biggest issues right now is going against the misinformation, the myths of what the COVID vaccine could do. And I'm just here to tell you that this is the vaccine of the truth. The truth is that the vaccination rates are helping us get back to a normalcy. Karina just mentioned just how the county is phasing out some of the orders, and one of the big reasons why we're doing that is because our vaccination rates are phenomenal, and our cases of actual COVID disease is going very, 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 very low. I mean, compared now to how things were back in November, December, and we're very happy with that. And lastly, I think for certain individuals who need a little motivation of why to get vaccinated, these awards and the concert tickets that we're giving away is a motivation. So again, you have that motivation, the motivation of going back to normalcy, the motivation of being protected by COVID, the motivation of helping not only yourself in the community, getting vaccinated. And yes, like I said, things are a lot better now, but we do need the last peoples who have not gotten vaccinated to please do so as soon as possible. And yes, I'm here to answer any of those questions that you may all have, and more of if there are any hesitancy questions, or just having thoughts of why not why not get vaccinated? So here I am.
Thank you. Thank you so much, Dr. Gerardo Solorio Cortez. We have several people who are tuning in, several who have made comments. I will go to the question specifically to you and related here, but I do want to acknowledge those folks that are joining us. We have William Ryan, who says hi. Hi, William. Thank you for joining us. We appreciate you being here. We have several comments, so it will be kind of hard and impossible to highlight any one of them. From Tino Garcia Barragan. Want to welcome Tino Garcia Barragan and all his thoughts and opinions he has. Welcome. That's where we're here. We're live. We're in public, with the doctor. Please ensure, to ask any specific questions to Dr. Solorio Cortez, and he's happy to answer any particular questions around the vaccine that you might have. We have Chris Cox here as well. Thank you so much, Chris. I know we also have several comments from Chris. Thank you so much for participating and being on here. Also, if you have any specific questions for Dr. Solorio Cortez, feel free to put them on here. And we have Judy Kettenhofen. In this question, I will ask Dr. Solorio Cortez, I believe it's for you. If Pfizer is 95% effective, does that mean there is a 5% breakthrough infections?
That's an excellent question, Judy, and thank you for that question. The CDC actually looked at vaccinated individuals, and the data up to March, or actually it was like mid-April, we were at the point of 150 million vaccinated individuals at that time. So I'm going to answer the question with real data that the CDC put out. So it was 150 million people. And of those, during that time frame, there were about 10,000, actually, no, let me step back, about 9,000 infections within that population of 150 million vaccinated individuals. So if you take 150 million and those 10,000, it turns out that it's a 0.0002% becoming infected with COVID after vaccination. So that goes to tell you how effective the vaccine is. It prevents infection. Furthermore, what the studies said is it was 100% in preventing ICU admissions or hospitalizations and death. And within this data that the CDC put out, yes, there were some hospitalization, but more in part where you were protected of COVID. And if you did get COVID, it was a milder disease. So point blank, what this is saying and answering the question of 95% effectiveness is that, yes, it's going to protect you from ending up in the hospital or death. And if you're in that, as I mentioned, the 0.0002% population that did become infected, it was for most part, it was a mild disease. So excellent question.
Thank you. And she further asked to clarify, she wants to understand regarding the terminology, if she has a terminology correct. So back to her question is, I guess, the 5% breakthrough infection, does that mean there is a 5% breakthrough infections? Is that correct?
Sorry, and that was in the studies. And that's why I think I wanted to give you more of the concrete data, because the 95% is more based on the studies that were done with the 40,000 with Pfizer and Moderna back last year when those studies were being done. Now we have more concrete data, the CDC database, that I could tell you that it's the what they came out with is a very low 0.00002% that could become infected. But go to answer your question, looking at the data, the 5% does it talks more about the percentages of those studies, Pfizer and Moderna.
And the terminology is correct. The 5% breakthrough infections.
And more, I would say the breakthrough, I would convert it more as a symptomatic disease, because they were looking more of people that had symptoms, not asymptomatic. It was more of people that had symptoms. So in that population, 5% did have symptoms, and 95% not. So that's why it was approved and saying that it was very effective, 95% preventing symptomatic COVID disease.
Great. Thank you for explaining that and clearing that up. Again, we have Dr. Solorio Cortez here answering any questions you might have regarding the vaccine. I will wait a little longer to see if any specific questions come to him. Otherwise, Dr. Solorio Cortez, I know it's a little quiet. Our audience today is being on the more quiet side.
I'll chime in since we have time.
Yeah.
The Delta variant, I mean, going back to when I was mentioning, there's pockets in our communities who need to get vaccinated. And there's some, information, coming out of just in the United States, across the world, of who are these individuals that are becoming infected. And it's those that are not vaccinated. And the troubling issue with the Delta is that in India, it caused so much destruction and deaths, and it was soon found out that it was a more transmissible and also a more severe form of COVID disease. So that's another reason the variants that we're talking about. And science has said that the current vaccines, J&J, Pfizer, and Moderna, are effective against these variants. So another reason why you should get vaccinated.
Okay. I do see another comment here from Timothy Hill. And Timothy, is just a message in general for us. Thanks to the Santa Clara County Public Health Department for continuing to achieve their objective to help prevent diseases and illnesses, encouraging people to get vaccinated that have not done so yet is an admirable thing to do. The higher percent we get vaccinated, the safer we will all be, including protection for the new variants that are appearing, less disease transmission, less deaths, and less serious effects of the disease. Blessings on you all for all you do. Thank you, Timothy, for joining us. And then we have Araceli Ortiz Medina. Yes.
Interject and thank you so much for that comment, Mr. Hill. That the fact that it's actually one of my blurbs that I give to my patients. He kind of pretty much detailed what I tell my patients of why we're doing what we're doing. So thank you very much.
Thank you. And then we have Araceli Ortiz Medina. Thank you, Dr. Solorio. Hi, Araceli. Good to see you again. I know you join us regularly. And then thank you, Judy, for participating and asking questions. Very good questions. That's the whole point, making sure that we're all aware and that myths are, dismantled and we get rid of any things that are not true out there. So thank you, Dr. Solorio Cortez, for also being available, to answer these questions. So she mentions, someone said they heard Delta had 10% breakthrough and UK says Pfizer is 89% effective. Are those two statements consistent or not?
So I'm not, so the data that I've seen or the reports is, going back to the 95% effective of Pfizer, Moderna, and Johnson & Johnson. I think the studies that are being done or the data or just looking at the patients, we're saying that percentages are very similar to these Delta variants. Let me step back a little bit. Like, for example, when people looked at the 70% Johnson & Johnson and 95% Pfizer and Moderna, you were pretty much comparing, apples and oranges, because Johnson & Johnson's studies were done later with more variants versus, what do you call it? The Pfizer and Moderna were done earlier on. But looking at all that, and also just at the real world data now, the percentages are still high. I can't give you if it's 70, 80, 95, but at this moment we're not saying that, hey, we need to get a booster because what we gave you, Moderna, Pfizer, and Johnson & Johnson, are not effective. We're saying the opposite, that they're very much effective even at your, your second dose now or your first dose, Johnson & Johnson. And that's the best I can, answer, and without looking at the actual numbers, data.
Thank you. And she is saying this really is simply a terminology question. Thank you. And I think, thank you, Dr. Solorio Cortez, for the additional information for some of us who, are interested in getting the additional facts. And she also mentioned we are proud of SCC, definitely. And it takes all of us. It takes you watching. It takes us sharing this information, sharing the YouTube later, getting the information out to our community. We're also happy to come out and do presentations. If you have any community groups, as public information officers, we're able to come out, sometimes bring doctors with us, but, at least we'll come and inform the community of the new changes. So let us know, how we can serve you in the community, which is why we're here for. And we have Wyatt Mikas, who mentions, thank you so much for allowing us to go in stores maskless, only if we get the jab. We know we're all following directives. And even then, Wyatt, I've chosen to wear mine still, even though I have mine. So, we'll continue to move forward. Like I said, in my community, we're still not celebrating. We still have many of our community members to get vaccinated. So I'm choosing to continue to wear mine. But again, we all have our choice. So thank you all for joining us. Dr. Solorio Cortez, any, closing words, comments for our community? I
want to feed off the energy as well. Thank you for all of you that have, become vaccinated. We are where we're at because of the work that we've all done. Thank you, Karina. Thank you, Quetzal, for all that you do. I think these informational sessions do a lot, and they pretty much give them the latest information and try to motivate our communities to become vaccinated so that we put an end to this pandemic. So thank you so much for all that you do. Thank you.
Thank you. And shout out to Quetzal, who is pretty much working the magic behind the scenes here and making sure that everything is on and connected and that you're all getting the information. So shout outs to you. Thank you so much for your hard work. And just to also give you a heads up, as a reminder, we have our Dr. Solorio Cortez here every other week. Every other community forum. So every other week we have our community forum, which means he's here once a month. So the next time we come, we'll have another guest. And then 2 weeks after that, he'll be back on. Happy to answer any questions. But we're here to serve you. As I mentioned, use our Facebook page, send questions in. You don't have to wait, 2 weeks or, a month. If you have any specific questions, we'll do our best to get the answers to you. And we're happy here again to serve you and the rest of the community. Thank you all. And we hope you have a great evening. Look out for those concert tickets. Again, that motivated my 12-year-old to get her vaccine. I'm going to have to go look at her ticket to see if she won. But regardless, I want to remind those who, even if you heard Maria, even if you already got your vaccine, you can take a friend. So like Maria, she called my daughter and motivated her, and she was able to get her ticket in there. Call around, call your cousins, call your friends, call your neighbors, and see, come on out, get your tickets, get your vaccine. Again, it's free. It's, as you heard, Maria, not painful. I also got mine. It was a little pinch that I got, my daughter too. So come out and get it. And it doesn't matter if you're undocumented. Everybody over the age of 12 in our county can now get your vaccine. So coming out and get them. There's plenty of locations and plenty of times and dates to choose from the evenings to the early mornings to the weekends. So come on out, and we'll see you soon again. Have a great 2 weeks, and hope you're enjoying your summer break. We'll see you again. Thank you. Bye.